Thank you very much for joining us for another COVID-19 update. I'm joined again by Secretary Kathy Kunkel from the Department of Health and Secretary Dr. David Scrase from Human Services. I'd like to start again by recognizing and thanking Lindsay Hinzia from Acoma Pueblo, who's also a nurse at UNMH. So a couple of things. Thank you very much for this mask. I appreciate it very much, and am diligent about wearing it, and know unequivocally that I am protecting others by making sure I'm protecting you from me. And also, it's a great chance for me to say thank you for your healthcare work and dedication, the fact that you're a first responder. All of us in New Mexico are grateful for your incredible work and service. All right, I'm going to take the mask off. I think I'm going to try to do this because it's I'll have to put it back on. All right. Again, thank you, Lindsay. It's wonderful, and I need them and wear them. And New Mexicans, remember that we are making thousands of masks and working diligently to get them out to you. A first large batch of several thousand are on their way. More are being prepared to be on their way, and we're going to work diligently as we talk about how we're phasing living with COVID-19, being in a COVID-19 world, what we do about opening up businesses and supporting our communities, and that means helping each other have access to face covering. So thank you very much, and again, thank you for your work. All right, let's go to the first slide. We're going to do a case update. Today we have 134 new cases. That gives us a total of 6,317. You'll notice in the modeling that like most states, we're not quite seeing a decline in cases, but we are feeling good about the stability of what's occurring in New Mexico. But that means that you still have to do more, and thank you for doing that. We have 206 total hospitalizations today. We've got 58 on ventilators. That number is a bit high when we compare that to national averages, and again, because we have to pay attention, and should, to what kind of healthcare capacity and making sure we have the right equipment and resources to meet the critical care of all patients and COVID-19 patients. That's a very critical aspect for us to be paying attention to. Unfortunately, we have 7 new deaths today. That gives us a 283 total. And again, this is the most painful part. These are all family members and missed loved ones, and this is an incredibly cruel way to lose a family member to a vicious, invisible virus that attacks without any warning, and for so many of us, without rhyme or reason, creates the kind of circumstances where you just can't beat this virus. And our condolences go out to all of the family members who have been so dramatically affected by COVID-19. You'll hear more about tests. We've got 147,344 tests. It's important to me to always remind New Mexicans that the amount of testing we do and continuing to grow that testing is critical to living in a COVID world until we have a vaccine. We need to be able to box that virus, isolate individuals and families who are affected or who have a positive case in their household. We have to be very clear that the quicker we do that, the more effectively we do that, the more information we give to employers and to a community about how we're getting that done safely, privately, productively, then the more we're able to do to sustain a new normal while we live with this virus in our state, in our communities. All right, let's go to the next slide. Or not. Oh, there we go. Sorry. This is a testing slide, so we're going to go to Kathy. I need to do a better job with our folks, just for people who are viewing, right? We don't rehearse. We want to make sure that you've got the right information and the right slides. We want to make sure that you get a testing update, you get a modeling update, and then I have other news, and I can sometimes confuse that. So, Kathy,
thank you,
Secretary, I apologize.
Good afternoon, everyone. As the governor stated, we are continuing to do our targeted testing with six major groups: long-term care, minority communities, tribal locations, essential workers, which focuses largely on healthcare workers, childcare workers, grocery stores, and utilities. We had a significant work with special populations last week, and thank you to the DD community, the home and community-based waiver providers, who tested 100% of their direct service providers by last week. The slide, please. We also had a significant emphasis on corrections, and the state has 11 facilities. The state completed 100% testing of their staff and 25% of detainees in all of New Mexico state facilities. In addition, we have moved into the counties, and 22 of our counties have also completed 100% testing of their guards and staff and 25% of their inmates. 8 counties are still in progress. We thank the Association of Counties and the county managers who assisted the Department of Health in accomplishing that goal. In addition to our work with testing, we are welcoming some new state partners in the lab capacity. This week, Pathology Consultants of Roswell has begun doing COVID testing in the Southeast. Christus St. Vincent has also begun their own testing in Santa Fe and brought all their COVID testing in-house. And we're looking forward to welcoming New Mexico State University, who is getting closer in standing up their own COVID testing. And with the increased capacity that we have in the state, we're looking forward in the next weeks to developing a more strategic surveillance system that will become part of the public health mission, much like our flu network surveillance has in the past. So I will be bringing you more information on that as our surveillance plan develops. And there are a lot of people who do a lot of work around the COVID efforts. Many of them are volunteers. I want to specifically recognize today the Medical Reserve Corps. And the New Mexico Medical Reserve Corps is a network of volunteers and communities that are organized under ASPR, which is the Associate Secretary of Preparedness under HHS. This network contributes to many things, including assisting us in extending our preparedness for our response in an emergency. And the MRC provides the structure necessary to identify, credential, train, and activate medical and non-medical volunteers. The New Mexico Medical Service Corps Coordinator, Bobby McKenzie, recently was awarded the Elizabeth Fitch Leadership Memorial Award. In addition, the MRC received an award for outstanding preparedness, resilience, and community response. The MRC currently has 70 volunteers in locations around the state, and since the beginning of COVID, they have deployed 173 volunteers and contributed over 3,883 volunteer hours. So congratulations to the MRC, and thank you to our MRC volunteers.
Thank you, Secretary Kunkel. All right, so we're going to do the modeling update, which is the information that we use routinely to determine whether or not we're meeting our goals in terms of reducing the spread of this virus, containing it, and supporting our communities and families and businesses to live in a COVID-19 world. So, Dr. Scrace, I give it to you.
Thank you very much, Governor. We're going to give you an update today of case progress. I'm going to follow up on a couple things we talked about last week as well to give you updates there. We're going to talk a little bit about the role of science in decision-making today as well. So if I could please have the first slide. This is something that folks got confused about last time. Some folks did anyway. We pointed out that 4.1% and plus 8.6% is 12.7% of all cases occur in children, those under 20 years of age. That and some folks took away and reported that 12.7% of all kids in New Mexico were infected with COVID, and that's not true. Actually, the highest infection rate in the state and possibly in the country is McKinley County, right now at 2.7%. So it's not 12.5 or 13% of kids that are infected. It's of all the cases, 12.7% are kids under 20, and that is the second highest in the state. You can also see the graph that I've shown you before about fatality rates for folks who get COVID with very high fatality rates in older age groups. You can see no deaths at all in people under 30, which is good news. And one thing that gets missed, and there was an article that came out about this earlier this week, is that the average number of life years lost for people who pass away from COVID is 10 years. So it's not mainly people in their last year or 6 months of life that are affected here, but it is really across the board and a 10-year average. So that's significant. I mean, think about what each of us would do with 10 extra years of life. Let's go to the next slide. We've revised this a little bit to give you even more information, but you're familiar with the orangish red line there. That's the Northwest. I told you last week that after another week, we probably would have enough data to tell us if we'd passed our peak. And we can say now that we've passed our first, hopefully our only peak, but at least our first peak for the Northwest. The next line below that, the green line, is the metro region, central New Mexico. And you can see that the Central region has actually had two peaks. We had one, and apparently more contact between individuals, and a second one that appears to be passed. I'm going to skip to the bottom two lines, which are the Northeast and Southeast. You can see small number of cases, fairly stable, a recent increase in one, but small numbers. And then the light blue line represents the Southwest. I told you we were keeping a very close eye on that last week. The number of cases is dropping on a 7-day rolling average, which is good news, positive news, but we're continuing to watch because you can see it's sort of level there from the graph, and we'd like to see it go back down. So good progress going up to the top blue dotted line, which is all of New Mexico. You can see we peaked about the 1st of May and hopefully are on a steady downhill course. This idea of reopening is tricky because it requires us to do some extra things to make sure as we spend more time with each other and have more contact with each other that we're controlling the spread of the virus. Let's go to the next slide, and we'll spend most of the rest of the time talking about gating criteria. We talked about this pretty much every week. These criteria are things that must be in place for the state to move forward. One thing I'd like to remind people that's particularly relevant right now is you can see that we're actually below our target for the whole state for the first time. We're at 1.12. That number, I'll make it easier if you multiply it by 100, is the number of people that 100 people with COVID would infect. So if we had 100 people with COVID right now, they would pass that on to 112 cases. If we weren't doing everything we were doing, that 112 cases would be 300 cases, and then, of course, those 300 would pass on to another 300. You'd have 9,000, and it would go up exponentially, but we're getting good control of the virus. Also, on the next slide, some of you may have seen this. This is our gating criteria again, but go to the following slide just for a second. This is www.covidexitstrategy.org. It maps all the states in terms of their pacing and whether they're ready to really start reopening, not completely reopen, but to begin phase 1 of the reopening process. And this changes every day. So I think yesterday New Mexico was yellow, the day before we were green, but it measures our progress against testing, which we're doing well on, the trend of cases, which is, as I showed you, going down, and then our hospital capacity, which is good. And I'm going to have you go back one slide now, just in that context. You can see that we have green boxes around all the areas where we're meeting our target. We have a target of 5,000 cases per day on the exit strategy. They hold us accountable for about 3,300 a day, but all the green boxes mean we're doing really well and meeting the targets we're trying to meet for the most part, and feel comfortable with this reopening process. Also, just to mention that we're not going to see the effects of reopening, which really started on Saturday to a significant degree for another for 10 to 14 days from then. So we won't see those effects right now. We'll see those in the future. But doing well in all the metrics in a little bit more detail. Now go to the two more slides. Sorry to jump around. Well, we'll go with this one. This is, we showed you that as a state, we are at 1.12. You can see each of the regions now is doing well. Metro, very good at 1.06. Northeast, 1.08. Southeast, slightly above. And this is related to a group of cases that occurred on the eastern border of New Mexico, a group of people who were traveling into Texas for recreational activities and brought back the virus to this state. Southwest, you can see we're concerned, but it's come down significantly, 1.33 last week, 1.16 this week. And Northwest now, which we've been following very closely for a very long period of time, finally that spread appears to be under reasonable control. And so great progress across the state. The thing that we need to keep in mind is that the stay-at-home order is the most effective tool for reducing spread because it keeps people from interacting with each other. And interacting with each other, although desirable as human beings, is what sets up a situation for the virus to spread. And so we need to make sure that with using masks and with staying 6 feet apart, that we're basically overcompensating for the fact that there's a lot more human-to-human interaction as we reopen. And that's what our data will also enable us to know as we move along. There was an editorial this weekend about whether or not we were blinded by science, and I did want to take a minute as the scientist designee to, although everybody here does awful lot of science, to kind of talk about what our process is and to make it really clear that science actually is, in my opinion, an invitation to open discussion and debate. And it's never our intention here to use science as a substitute for logical arguments or providing specific data to make decisions. So I want to make sure that was really, really clear. I also will say, though, that given a choice of using a little bit of science when we have it or no science at all, I'm proud to be part of an administration that has a bias toward using what data we have. In this COVID pandemic, we review, the MAT team reviews 60 to 75 articles every single day. With the rush to publish, there's less control criteria over evidence, so it takes a lot more looking and in-depth research to see if these articles make sense. One example in the editorial was, hey, 8 weeks ago, Dr. Fauci was saying, you don't need to wear a mask, and then 4 weeks ago we said, you ought to really consider wearing a mask, and then last week we said, you really should, it's an order that you wear a mask, and the reason that's happening is because science is changing. And I won't go into too much detail, but that original study that I'm sure was the basis of Dr. Fauci's opinion was a single-layer cloth mask used by people who worked in an intensive care unit with infectious patients. And as we know, that's not the kind of mask we use to protect healthcare workers, and they did get infected. But 4 weeks ago, some data came out that showed that those multi-layer cloth masks were protective, protects other people from you transmitting the virus and sending off droplets. We recommended them. And then about a week and a half ago, new data came out that said not only do these work, but they can save 17 to 45% of excess mortality, which in New Mexico translated to almost 1,800 lives. And so at that point, that's when they were mandated. So science changes. The central part of science is debate over the data. We're going to make new resources available to the public. We'll provide links on the medical advisory team website to that compendium of literature, and we're also going to be publishing the gating criteria now with updates where we update them 3 times a week as well. So you'll be able to look at that, see that more. And if you have data questions or are concerned that we might be using science as a hammer rather than a guide to help inform us in strong public policy, please feel free to reach out to me for comment or with specific questions. There aren't really any absolutes in science, and so there's always a debate, and we're happy to participate in that, and we'll be happy to bring our evidence, and you bring yours, and we'll have a spirited discussion about what can best inform public policy. Okay, end of science soapbox, and if we could now move on to the next slide, please. We'll keep talking. This is the rate of spread by region, and it's just a graph of the data I showed you. A little harder to read, but you can see most of those lines now are down below our target with just a few sitting right above, which puts us in a very, very good position, and in fact, in a better position than most states in the United States. Next slide, please. Just to show you our travel guide for New Mexico, we had that very low point, that bottom spike was Easter, and since then there's been a steady uptick in travel and a typical high Monday, Tuesday, Wednesday, Thursday, Friday, low Saturday, Sunday pattern. We're watching that because we're concerned that the more we travel, the more opportunity there is to spread the virus. We're working with Los Alamos National Labs, who's actually adopted the New Mexico approach to this data, and they are finding strong correlations between travel and spread of the disease. So watching that closely. So enough for the gating criteria of spread rate. Let's move on to testing. Secretary Kunkel, again, expanding testing dramatically. You can see the slope of the line going up. We're stable at around 4,414 cases on a 7-day rolling average yesterday, which is a really good average, very close to our target. If anybody has a couple 100,000 test swabs out there, please let us know and send them in. That will help us get to our target as a state. I'm going to skip over the time to from testing to isolation of the case and then isolation of their contacts. We're doing very well on that. We don't have an automated system. We continue to work on that. And lastly is delivery system occupancy. And again, we're doing well there. If I could have the next slide, you'll see a graph that shows a black line, which is we're finally getting our reporting down to every day. And you can see that the 7 hub hospital ICUs, which are our critical resource in New Mexico, we're at 283 beds filled. And that, I want to give a shout out to our hospital leaders because they really only have 230 ICU beds, but they found a way to expand their capacity for this pandemic. They're filling beds above that, and we have a good margin to go before we get to what we would consider crisis care, where that solid red line is. And we would be certainly telling you more about that if that time was coming. But right now, we're doing a great job. I think as of today, maybe 285 transfers from regional areas of the state into Albuquerque for care, mainly for COVID patients. Also wanted to mention, though, that the main type of patient that's filling up hospital beds right now are people with non-COVID medical conditions. And we're starting to see a trend here in New Mexico and also nationally of people who delayed care out of understandable concern for the past couple months. But now is the time to resume that care, get your kids immunized, get your heart or diabetes or other conditions checked. We've seen a fall off and monitoring of diabetes control. And so please, urging you today to get back in touch with your provider and make arrangements for that, to resume that care now, because we don't want you to end up in the hospital or in an intensive care unit bed because that disease pattern is out of control. And lastly, we've got the PPE situation. We want 6 of our 7 hub hospitals to have sufficient PPE, and actually it's been 7 every day. One hospital or another didn't report on 3 of those days, but we do have adequate supply now, so that's not a constraint. So all in all, to summarize, we are, on the next slide, better than target on spread rate and want to keep it that way. I'm sorry, let's skip this slide. Maybe we don't have the, do we have the summary slide in there? Do you know? Okay, we don't have a summary, so I'll just briefly go over it for you before I turn it back to the governor. Our spread rate's better than target. Testing still significant improvement, better than national standards, a little short of the New Mexico standard, but we're getting there. Send us your swabs. Contact tracing is being automated, but we're very close to where we want to be there. And the delivery system capacity is on target. Again, though, remember that the social distancing measures really are what's controlling the virus. It's though if we had jumped out of an airplane with a parachute on and we're gradually descending and finally started to slow down and drift towards Earth, but we're still maybe 1,000 feet above Earth, we would not conclude it was time to take off the parachute. It would be time to continue that slow descent and prepare for a landing in a COVID positive world. Just the same, we're not ready to completely reopen everything. We have to go slow. We have to look at data. We have to give ourselves a couple weeks between steps. Meanwhile, stay at home particularly if you're a high-risk individual. Wash your hands, clean off surfaces, cough into tissues, wear those face coverings in public and keep those 6-foot distance to help us adjust to more human interaction. And I think we can slowly make it to a place where we can balance reopening our economy step by step and keeping the disease under control. Thank you very much, and I'll turn it back to the governor.
All right, thank you, Dr. Scrace, and I'm really happy that that happened to you too. It makes me feel like I'm not the only one. We want to make sure that when we're talking, you can follow along and see the data. We're also clear about getting it onto all of the COVID-19 websites, whether that's a direct Department of Health website or it's a New Mexico state government website. And again, we don't want to be flip about how we present this information, but we do. It's an earnest, day-to-day effort to make sure that we're updating every single dashboard. We're looking at not only what the current cases are, but the trends. And one of the reasons that both Dr. Scrace and Secretary Kunkel's information and presentations when we do these press conferences are so important, because it meets that overall 4-part gating criteria, which is how we make decisions. And in that one slide that showed New Mexico as green with Michigan, that gating criteria is widely held. Not every state has the same measures for what they identify as gating, but it's a commonly held, you need more than one data set to determine where you are given the rate of transmission, the impact, your ability to isolate the virus, that you have got every state's got a different healthcare capacity response. So how you determine what those measures are, and then really holding. Now, here's the interesting thing that the entire country, frankly, is engaged in, and New Mexico is no different. There are two things going on, and I'm almost ready for the slide because I have to cue them because we just go off script, and we should. This is a dialogue between us and New Mexico about where we are and where we're going. All right, so the White House, and in my opinion, rightfully so, several weeks ago said, look, as we make decisions to reopen the economy, 2 reasons, right? We've got significant economic losses that must be addressed. And 2, we've got constituents who want access to any number of services. Those are real issues. They can't be either or in terms of public health and safety. So what can you do that allows you to create circumstances, right, like COVID safe practices and masks and slow openings and reviewing the case numbers and related gating criteria? What can you do that gives you confidence that you can open? So the White House says when you have 14 straight days, which is basically, right, that quarantine, incubation, and isolation number of days that the CDC identified, then when you have 14 straight days where your cases decline, then you can safely begin to reopen your economy. And that means it's staged. Well, no state met that, including New Mexico. Now, states decided, for any number of reasons, and they are free to do that, to reopen in whether or not they meet their own gating criteria, or, in fact, in lieu of CDC initial guidance about what was safe, which the White House initially adopted. So the problem with that for us, not only as policymakers, but for New Mexicans who are working hard to adhere, right, to these new practices and living in a COVID-safe world, is absolutely, it's got 3 major issues that I want to talk about. One, that there's a real social isolation aspect, and I want to talk about behavioral health, and a sense of hopelessness about if we don't have a vaccine, is it ever truly going to be safe? And so we want to mitigate those risks, and we want to give people confidence that we're doing that in a safe, prepared, productive way. 2, that we're going to realize that if we stage these openings, that we keep people safe by making sure that the data points are holding, so that you don't overwhelm your first responders or your healthcare systems, so that you're really clear that you don't have to go backwards. I mean, the worst thing for everyone, not just businesses, but consumers, is to open up and then have to shut everything down again. So making it slow and steady, not so slow that you don't have any hope or realize that we'd have an impact, but slow enough that the data follows our decisions, that we can tell you the impact of those decisions. And then last, in fact, geography does matter. And because people do travel and we want statewide decisions because we know people travel, we want to try to frame these in terms of what's going on regionally. I want to show you why other states' activities do have an impact on New Mexico's ability to stay the course and show that we're making real progress. So let's look at the slide that talks about Texas and El Paso. It's just a slide after this. There we go. So we're not picking on El Paso. The mayor of El Paso and I have been in contact with each other. We're working together. I can tell you that that mayor and other local elected leaders are working with Doña Ana County elected leaders and Las Cruces leaders. And of course, I have the opportunity to work with Governor Abbott. But El Paso is an area that's basically comparable to the size, not just of Albuquerque, but all of Bernalillo County. Now, the cases and related mortality deaths are rising in El Paso. Yesterday, there was a 39% increase in one day in hospitalizations in El Paso. So the COVID-19 spread in El Paso poses an incredible risk to Doña Ana County and therefore the entire state of New Mexico. So you might remember, and Dr. Scrace will correct me if I use the wrong language related to this, but there are two issues, not just the rate of transmission and spread, which is critical, and we use that as gating, but it's also the prevalence. If this virus is spreading so rapidly and is ravaging a community or a population, then the likelihood that you come in direct contact with it in a number of places, open businesses and restaurants and entertainment and workplaces and grocery stores and gas stations and convenience stores and parks, gets higher and higher and higher. And if you're traveling between an area of that nature and New Mexico, you're increasing risk. And so just because another state is reopening faster is not an indication that faster is better. Faster means that you can contain the virus and that they're not going to have to make really tough decisions. Like, for example, now they're treating El Paso differently in Texas in terms of its reopening because they've got a containment issue. And actually, I appreciate that decision making by Texas, but there are still far too many things open in El Paso that may not quite be ready to be opened in New Mexico. And if we aren't careful and we aren't clear that people move between communities, we spread risk not just to Doña Ana County, but you spread risk to every other county in New Mexico. So these are things that we are also paying attention to. So we're looking at what's happening in Texas and Arizona, our neighbors. And I want to make that point. I want to hit that hard. Go to the next slide, because New Mexicans get really frustrated. But I can go across the border, but you are exposing yourself and other New Mexicans to risk. And until there's a vaccine for this nation and all states meet their gating criteria, we have to be cognizant about the controls that we can put in place that keep New Mexicans as safe as possible and allow us to keep opening businesses without having us to take a step backwards. That's what's critical. All right. So what should I be doing? I know that we seem like this is harping, and that's not our intent, but it is really important. Stay home. Except for work, your basic needs, which we've identified as urgent needs. People need fuel, people need food, people need medicine, and emergencies. Wear your face coverings. I want to give New Mexicans a shout out. By and large, they're wearing them. I know that there's some political discourse around the country. For us, it's not about politics. This is just about making sure that I keep you as safe as possible, and that allows us to live in a COVID-19 world. That's what we're doing. Keep 6 feet of physical distance in public spaces. You might note that I keep saying that we're at least 18 feet. Somebody finally measured, so we're about 11 feet apart, but well beyond the 6 feet of distance. Social distancing is critical. It is another mechanism that allows us to prevent spread by doing our part. Don't congregate in groups. Don't do it anywhere, at parks, on hikes. And when I go out for groceries or to run, to do the things that I'm asking everyone to do, right? I'm staying at home, except for work, like today, where I can telecommute, I do that. But if I need something, I wear my mask, I take all the COVID safe practices, and I really support businesses in Santa Fe that are also maintaining the best COVID safe practices, right? Doing everything that they can. And I notice behaviors that just aren't quite there. A couple, one person wearing a face covering, another person not. That as people are waiting, they're way too close together. They're not 6 feet apart. I know it must be very frustrating while you're waiting in line. I don't want to give myself away about where I was, but working on your takeout, it just seems way too comfortable to keep getting closer and closer as you're in line. Try to resist those behaviors. In grocery stores, inside the grocery store, everyone practicing to the highest degree COVID safe practices right outside. People are removing their masks and their people are right next to them, including workers. And every time you're touching your face covering and you touch your face, you're creating risk and potential spread. So don't do it. Really try to change these behaviors, and they're hard. If they weren't hard, we wouldn't keep reminding you. Support your local businesses. Look, we're creating this opening in this phased in and limited approach. There is no local business who isn't suffering, not one. Even with the metering, right, and taking our time and changing and expending more resources for face masks and coverings and different ways to do things in grocery stores, right? These are expenses that they didn't have before. Do everything you can to support our local businesses and our local economy, while at the same time recognizing that it's not an invitation to be out and about in ways that create more risk. I realize you're going to have to help us with those balances, but it's really important. BuyNMLocal.com is a place that you can go to really see where you can support local businesses. All right, let's keep helping each other. This is going to be a long summer. We're going to be opening up. We're going to be showing that we can do that safely. We're going to be reminding you. All of the public health experts, not just in the United States, but around the world, are predicting that in the winter, pre-vaccine, we could have another surge of this virus making its way around the country. And as that happens, it doesn't disappear until then. It's just when we expect, like flu season, really knowing, as learning more about this virus. Assuming that happens and following the healthcare experts' advice, everything that we do now, every behavior change, right, means that we wouldn't have to close our businesses. That is critical to not only New Mexico's health and economy, but to our safety and well-being. So let's really do that. So what can you do? Help your neighbors. Offer to shop for groceries. Make face coverings if you have extra fabric or other resources. Encourage them to contact us so that we can get them a face covering. And this is really important. I'm going to talk a little bit more about this in a minute. Reach out and stay in contact. We know that isolation, right, these stay-at-home orders, not only are important and valuable to manage the spread of the virus, but they create real impacts on all of our behavioral health. We're not seeing our families. We're not seeing our coworkers. Our children are not seeing their friends and their teachers and folks that they count on in their schools. This is a significant issue. They're not getting to do their sports. We have to be cognizant that these are real behavioral health risks. So reach out. FaceTime your neighbors and your friends and your colleagues, your coworkers. Make sure that we're really doing our part to engage to the highest degree. And then monitor yourself and your families for symptoms. This is really not about behavioral health, but I'm going to make it about both. We want more people to get tested. I'm going to talk about something I didn't talk to my team about, but we mentioned it a couple weeks ago. Facebook has an app where you can sort of get on if you think you've got symptoms and really go through them There are hospitals now around the country that are really limiting their exposure and and really enhancing their containment efforts by making sure that every employee has an app where they monitor themselves for any symptoms: cough, fever, sore throat, nausea, headaches, loss of taste or smell, and any number of emerging symptoms that are really important for you to evaluate, because far too many individuals don't think that they are symptomatic, and they are. And then, of course, get tested, because there are also a significant percentage of the population that doesn't have any symptoms. So we just want to make sure that people are really engaged in getting tested. That's the kind of surveillance that we need. And then monitor yourself for behavioral health. If you don't feel right, think you might be depressed, feel lonely, anyone in your household, then we want you to reach out for support. And I believe we've got a slide that's going to talk about that. So let's go to the next slide. I'm ahead of myself, so let's do that. That's great. Perfect. Then we'll go back. So here's some behavioral health resources we really want you to know about. So NM Connect app. All right, I talked a little bit about apps. Here's a New Mexico app. It's downloadable through the App Store and Google Play, and it directly connects to or texts a counselor or a peer support worker. This is an incredible aspect of making sure that no one should feel like they're in this alone, and that they don't have access support to help navigate the isolation and potential depression that we're all feeling. New Mexico Crisis and Access Line. This is 855-NM-CRISIS or 855-662-7474. This is a statewide mental health crisis line for anyone who's concerned about suicidal thoughts, substance abuse, grief, and other behavioral health issues. We really want people to have these important lifelines. We all need this, and we want to make sure that folks know that there's a statewide mental health crisis line. We also have a healthcare worker and first responder support line. We don't want there to be any wrong door, but we know that there's a unique set of circumstances and specific behavioral health risks that occur in healthcare workers and first responders in this pandemic public health crisis. That line is 855-507-5509. One more time, 855-507-5509. And then we have a peer-to-peer warm line. All right, this is assistance and an understanding ear to New Mexicans who just want to talk to someone about their own mental health, substance abuse, or recovery. Again, really no wrong door, but we want people to feel like they can reach out in a number of ways and that there's someone available to you to just talk you through what you might need or what's available, and to make sure that if you determine that you need to see a healthcare professional, that we have any number of vehicles to make sure that you have that behavioral health support as well. All right, I think we're going to go back a slide, which is, okay, what else would help with that sense of isolation, right, and that feeling like we have no new normal? Well, we do believe that addressing economic issues and giving people a sense that they can engage in a more social way, keeping COVID-safe practices intact, that we are on track for a June 1st dine-in for restaurants and reopening salons, gyms, malls, and other services. And as we're looking at information, right, we might come to you even earlier, but right now we want you to know that there's nothing that we're seeing, even though we had an increase in cases today, largely related to a high-risk area, that we don't believe that we aren't going to get to our targets exactly when we should for how we can have safe reopening. All right, so restaurants, salons, gyms, malls, and other services, June 1st. How do we get there? All the things I already said. Reduce the spread of the virus. We keep the virus at bay. We keep socially and physically distant. We wear face coverings. Then it means that we can stay on track, give ourselves a little break, and support our local economy. All those things are really important, and they can be done if we do this well together. Stay healthy, protect your first responders and your healthcare workers and hospital resources, and you do this by taking personal responsibility and respecting every New Mexican who is anxious for a safe, viable, gradual reopening. I want that too. It's really important, and we're getting there thanks to you. All right, and we're following the public health data, right? I'm not looking at Arizona, I'm not looking at Texas, I'm following our public health data, but I'm recognizing that they've already had to go back a couple of steps in some of their communities and counties. We want to keep moving forward. That's a much safer, much more productive environment for New Mexico to be in, and we're doing it. We're on track. So I want to thank you for doing your work. I want to thank you for working hard, for staying safe. I want to thank our first responders, including grocery store workers and child care workers, everyone that's making this system move and is giving us the opportunity to keep ourselves, right, safe and to allow us to get our personal needs met while New Mexico lives in a COVID-19 world. All right, I want to thank you very much for tuning in and doing your part to make sure that we stay on track and meeting the gating criteria. I want to thank Secretary Kunkel and Secretary Dr. David Scrace, because the testing work that we're doing is incredible. The tracing work that we're doing and the automation efforts and the training of new personnel, those are the two things that allow us to manage this entire effort for the life of the pandemic, which by all accounts is at least the next 24 months, could be as much as 18 to 24 months until we have a vaccine. So let's keep making progress, New Mexico. That's my commitment to you, and I know that you're doing your part. Thank you. And with that, Nora, I think we're ready for questions.
Thank you, Governor. All right, folks. First, I'm going to go to Dan Boyd with the Albuquerque Journal. Dan, you're unmuted. Go ahead and ask your question.
With that, Nora, I think we're ready for questions.
Thank you, Governor. All right, folks. First, I'm going to go to Dan Boyd with the Albuquerque Journal. Dan, you're unmuted. Go ahead now.
Yes, good. Thanks. Good afternoon, Governor. Two quick questions, if I could. First, there's been some national reports in recent days about speculation about the vice presidency with Joe Biden, and wanted to see if you could comment at all about that and tell New Mexicans about kind of what the latest is. Secondly, wanted to see if you could provide kind of an update on special session preparations and where things are on that issue.
Thank you. Yes, there is flattering news about a variety of incredible women around the country, and I appreciate the recognition of the work that we're doing in the state and in my experience. But our communication with the Biden campaign, because it's primary season, is about, endorsement and making sure that we're working on getting folks ready to go to the polls, and I'm committed, as so many other Democratic governors, to make sure that we have a President Biden, not just a Vice President Biden. There's no question that given my leadership role as the chair-elect of the Democratic Governors Association and any number of other efforts to engage particularly minority voters, not just in our state, but around the country. We're working diligently to make sure that we're providing whatever support is necessary. And the rest of it, I think, is just that. Political speculation, and while flattering, irrelevant about making sure that I focus on doing my job as a governor and where I can be helpful in terms of motivating a political response for what I believe would be the right president, given the conditions that this country is facing. Will continue to do that political work as appropriate and as diligently as I can. Special session. We are going to start the special session on June 18th. That's a Thursday. We expect to be done over the weekend and are working with the leadership in the House and the Senate to make sure that we have a productive special session, which is about making sure that any changes to the current fiscal year get addressed to make sure that the state stays in the black. That's my dedication and responsibility, and that we're doing everything we can to shore ourselves up to deal with a looming deficit for fiscal year 21, and making sure that we have confidence together, and we do, that between reserves and the federal stimulus money, that we're in the best possible shape to deal with this economic crisis. I don't want to diminish that we have an economic crisis, but to make sure that we make the decisions early that place us in the best possible position for the next general session in January. So, June 18th. In and out, and I'm feeling very optimistic about our ability to have great agreement, and bipartisan work is what we're hoping for, of course, to make sure that we make the changes necessary to keep all of the wheels turning in state and local government. Which, just as a reminder, that's first responders, educators, right? Our hospital and healthcare systems. It's all the things we need to make sure are really in good places all the way through the next legislative session. Nora, next question.
Thank you, Governor. Next, I'm going to go to Chris McKee with KRQE. Chris, you're unmuted. Go ahead and ask your question.
Thanks very much. I wanted to ask a question about the state's 2015 pandemic plan. I'm not sure how entirely familiar you are with this, because of course it was published in 2015. We aired a story yesterday just about looking at that pandemic influenza plan. It's clear just from a really, I think, cursory kind of look at it that there are definitely some gaps in there. There's sort of just generally a reliance maybe on the CDC and the federal government to make sure that, say, things like PPE or testing happens. And obviously that has not really come to fruition exactly like that during this pandemic. My question, simply put, and maybe to Secretary Kunkel as well as Governor Lujan Grisham, is just, have you had a chance to even think about this pandemic plan and sort of thought, did we have enough preparation with this kind of plan? And is there an area, do you think, that we're going to work towards like making a new plan once this is all said and done with? Was the state, I guess, so to speak, prepared?
So I really appreciate that question. Yes, I'm aware of the 2015 plan. It's weird that you would ask me that question, because I was talking about it actually this morning with folks at Homeland Security. And you might remember that I talked about asking folks to do our emergency preparedness, we call them a tabletop, where you get all of the experts and really refamiliarize yourself with what plans are in place and what ought to be shifted or changed as a result. And back from mine, then I'll go to the Secretary of Health, my days at the Department of Health, you have to be preparing all of the time. And the problem with these plans that get put on a shelf is it is very easy for any administration, including the last one, to be stagnant. In fact, I was worried about that during my first year as governor. And worried, what I mean by that is, it needed to be a priority even without a pandemic. I wanted much better preparedness, and I wanted a much better effort across the cabinet and with our local emergency managers around the state, so that we could do anything, whether it's earthquakes or fires, make sure that we are ready for anything. And when I saw what was going on in China, I was clear that we should really do it from a health perspective. So first, a 2015 plan, because it's 2020, is too old and not relevant to look at any number of issues for any public health issues. So that's clear. So we knew it needs to be updated, and there are folks actually working on that. And I wouldn't be a bit surprised if you had access to a new plan or components of one based on what we've learned on June 18th. Two, you do need really strong partnerships with the federal government. There are things that we are clear that there are certain roles that need to be done effectively in order for the states to operationalize any number of efforts. And so if you want to be on the ground dealing with any kind of public health emergency, you need to know that the federal government is making sure that the supplies that you need, testing and tracing and guidance and doing the latest national, right, scientific work, that's a fair place for the federal government to have a leadership role. Was any state expecting that we might have trouble with the federal government? Can't answer that. I can tell you that we were prepared for a plan B, which is if we have to rely on a federal government with limited expertise in public health who denies that we even have an epidemic or a pandemic until the rest of the world is clear that we do, we need to be ready to do things ourselves, which quite frankly is why we had enough PPE, which is why we figured out how to expand our healthcare capacity, which is why we took such swift and strict measures early on, because we have half as much healthcare resources per capita as any other state. And it was clear that that wasn't going to happen at the federal level. So do we learn things along the way? Always. If you're not learning and you don't have experts on either side helping you make the decisions every day, then you're not engaged in emergency preparedness. But good question, and thank you for paying attention. Me too. Secretary Kunkel, I'll let you talk about the stuff that you're doing directly.
Thank you, Governor. And
I'll ask you.
The Department of Health did update their pandemic response. I don't know that it's called pandemic, but it was upgraded last year. And last August, the Division of Epidemiology and Emergency Response participated in a pandemic exercise that helped them upgrade their practices. But having said that, I think that nobody was prepared really for what COVID brought to the world. So I would say that in spite of the fact that I believe the Department of Health did upgrade their plan, that what we've learned, as the governor said, what we've learned over the past 4 months will significantly impact the way we look at this in the future, and it does need to be redone again. Thank you.
Dr. Scrace?
Just one quick comment as well on this. There are other documents that are very informative online. There's a crisis standards of care plan that was developed and updated in 2018. You can find, and also on the medical advisory team website, on the top red banner, if you click on that, you'll see our supplement that was prepared by the medical advisory team. That's the acute care medical surge plan. And so I agree with everybody about continuous updates, but there's to go to a 2015 document and think that might be the only thing we're using would be a mistake. There's a lot more detailed and specific information about what we're doing in all the documents that have been mentioned. Thank you.
And I might just do one more thing, and I don't want to take too much time on individual questions, because I want to make sure everybody gets a chance to ask their question and get it answered. But certainly in my professional career, CDC, FDA, infectious disease experts, irrespective of what political party occupies the White House, those are never politicized. And today, in today's world, not just in the United States, but these issues are politicized worldwide. And it creates a different dynamic about responding to a public health emergency like this. So I'm going to actually compliment New Mexico and both parties. And that's not to say that we agree on everything, and it's not to say that it's always been, politically cohesive. But for the most part, this is a state, even when we disagree, that is willing to look at the facts and to look at the science, to have trust in their elected leaders, and to know that you should expect us, right, to be interested in new information, new strategies. The technology, even the apps about dealing with a pandemic and healthcare information were not available in 2015. So this is a very dynamic environment we find ourselves in. And I'm going to disagree with Secretary Kunkel. I think in large part this is a department that has the kind of expertise that can, and flexibility to do any number of things in real time, and then absolutely support her. Every single cabinet secretary is clear that the best preparation is doing it every single day and making the kinds of adjustments that make sense, particularly now that we're living in a COVID world for the foreseeable future. So I want to thank them both. Next question.
Thank you, Governor. Next, I'll go to Morgan Lee with the AP. Morgan, you're unmuted. Go ahead and ask your question.
Hold on, I'm just muting. Hi, thanks for taking my question. Could you tell us a little bit more about, you mentioned there's a group that brought back the virus from Texas during a visit, was it? And then regarding the special session, what kind of, what's the size of the budget gap? What kind of hole do you have to fill, and where might sacrifices be made in terms of personnel? That makes up the bulk of general fund spending, of course, or people.
It does. Thank you very much, Morgan. I'll do the latter part of your question first, and then I'll defer to Dr. Scrace on, but sort of remind people as a precursor, right, that COVID got here, and it's not, from people traveling. COVID originated in the Navajo Nation in some places, because 3 states, in school settings, and in New Mexico in a church service. So we know these originations create high risk, and want to make sure I go back to Dr. Scrace. So we think right now we need to be clear that about, well, in the FY21, if I average the different economic, right, and experts' projections, it looks at, so I've got several economists, LFC, we have our own at DFA, and others. You're looking at anywhere between a, $1.8, $1.9 billion deficit to 2.8. So if I just look at the average, get to 2.4, I need to make the adjustments today that minimize that impact going into FY21. So what we're looking at is how we're going to use the $1.2 billion that the CARES Act has made available, which is the first stimulus. We've also received $77 million that's available to continue our testing efforts. And where we've gotten guidance from the Department of Treasury, federal U.S. Department, we think that we can cover much of the personnel costs in the agencies or departments that are expending the most personnel resources responding to the pandemic, right? So the Department of Health, Homeland Security, National Guard, Human Services Department. Then we know that specific things, that what we've spent in food and testing and contact tracing, that we make sure all of that gets done. And we think that there's sufficient resources, still lining it up, to make sure that we can get some economic investments out the door, assuming that guidance holds from the federal government, and then looking what other stimulus might in fact be passed, like even some combination between, the House HEROES Act and what the Senate is working on bipartisan for more money that fills the gaps in state budgets. We think that we could be in pretty good shape and would not have to your question, furlough, lay off, right? Not support our education investments, not support some of the public health and basic needs, water, for example, and make sure that utility infrastructure, that capital, and roads where it's a public safety issue. We don't want to stop any of that capital. So we think if we are clear about what we've already done, right? We're not, we want the legislature to get a chance to take a look at some capital projects that we didn't veto on the front end, seeing this coming, but they might want to take a look at. We think that with the CARES Act money, we think that with other federal stimulus money, we might be in a position, if we don't, for freezing and not expending money, that we wouldn't have to make any huge negative adjustments to the current operating budget. I think it's going to get harder in FY21. So that's our expectation, but it's early, and we're counting on some other resources, and we are counting on that the legislature is going to have to take a look at allowing us to tap a percentage of the reserves. There's been no agreement about what that percentage is to deal with the budget deficits. And for people watching, what does that mean? Well, if the economy's depressed and oil and gas is down, the amount of money that we were expecting to come into state government to support state government operations isn't there. So in order to make that up, it's federal money that's here. It's more federal money that's coming, and it's getting money out of the reserves and maybe changing some of the capital projects investments that were authorized and signed by me last legislative session. We think that that's going to do the trick in large part. So you wouldn't see huge cuts in operations, in necessary government services, education, first responders, public health, healthcare services like Medicaid, money to hospitals, et cetera. Children, youth, and families, social workers. We're expecting child care to stay the course with those essential services. Dr. Scrace.
Yeah, I just want to put the remarks I'm about to make in some context. I'm looking at an article from the Washington Post where thousands of people flocked from Washington, D.C., which is still sort of closed, to Maryland and Virginia, which is now partially reopened. It's the nature of human beings to want to get out, especially if they've been cooped up and move around. Also, we've been following El Paso very closely, and I was watching a newscast from El Paso, I think 2 days ago, where they were kind of pointing the finger at New Mexico for some of their hospitalizations being related to infections they'd picked up in southern New Mexico. So it's kind of the nature of these issues, but what they all have in common is people traveling from one place to another, people abandoning social distancing, people taking advantage of the opportunity to get out. And so we did have a doubling of the number of cases in one county end of last week from folks who did do some of that traveling and recreation, then went back to work. One thing, a message from epidemiology today, because we've also seen a number of small outbreaks of people where a number of people got sick as a result of one person coming to work sick. If you're sick, don't go to work. Please, don't go anywhere if you're sick. Call your provider, make arrangements to be evaluated if needed, but do not go to work sick. And that's one other thing we can do to help keep the economy open as well. You know, of course, we don't give names or individual locations, but I think all of those examples I gave with people going to Virginia, El Paso people coming into New Mexico people going into Texas, all examples of where movement actually and people coming closer together creates greater risk, creates spread. It's how the virus replicates, and it's what we have to most fight against. Thank you.
Next question.
Thank you, Governor. Next, I will go to Tommy Lopez with KOB. Tommy, you're unmuted. Go ahead and ask your question.
Hi, guys. I have two questions here quickly. One is, as we look at the data in Gallup, is it showing us anything in terms of if we can see if there's any result of the lockdown, evidence that it was successful or that there was any changes there? And then secondly, I wanted to know if there's any comment you can make about when we might know when we're past the peak. Is there a point that we could highlight where you would know now that if we see that, we know that there indeed has been a peak and that we're past it? Thank you.
All right, so I'm going to do the second question again. I'm going to defer that to Dr. Scrace, because in one of the slides, we showed that in a couple of regions, we might have had a couple of peaks that we think were beyond now all of the peaks that, in fact, actually are end of April, early May, right? Projection based on the modeling, that's when the state as a whole would have a peak, actually did occur in that context, in that range. And so we think that we're through the peak. Now, the key here is, and this is the danger in any of this modeling, and we get asked this frequently and should. It can't be the be-all to end-all. It is a set of information that we use as a guide that's based in science, epidemiology, population health. And if we don't manage our new COVID-19 reality, you could see transmission rates increase. We could have a containment issue that's problematic. You could have a region have another spike, and our goal is to prevent that. But what we're seeing now is that spikes have occurred, those peaks, and we are flattening still, and even seeing a reduced rate of transmission in certain regions of the state and as the state as a whole. Those are all indicators we want to see, and I might have Dr. Scrace pull those slides up again just so we can do a reminder. And then you asked specifically about Gallup. So both Gallup, well, I'm going to do McKinley County and San Juan County, but we do look at zip code. And do you want to put that slide up by zip code? Well, we don't, I'm looking at you while you're showing a slide. So those cases are becoming more stable, right? We're not seeing huge increases every day. And in fact, I think it's possible, and I might have written this down, I'm going to look, that we might have had fewer cases today than we did yesterday in Gallup. Is that true, Trip? I think that's exactly right. I get the data increases so people know. I get a lot of questions about that. Why do you do these briefings late in the afternoon? And how does it work? So we run tests in a 24-hour cycle. We try to plan in a week, during a week, about where we're testing. Then we populate our dashboards and databases. The medical advisory team is looking at that in real time and also looking at national information, doing appropriate comparisons. Then all of the leaders, which is most of the cabinet, and they're all leaders, but in terms of the specific pandemic response, then we don't only look at the new data, number of positives, number of tests completed, number of hospitalizations, what the mortality rates are and issues, where the occupations are, where the high-risk areas are, what's going on in nursing homes and corrections and hospitals. We look at every single one of those dashboards and then have a very, frankly, complicated conversation about what it means or doesn't mean. And that happens around 2 o'clock every day. And that's why we do these press conferences at 3 and 4 o'clock, because we want to have access to that information. I also apologize to New Mexicans, if we look at each other and aren't clear about the timing, because we've just finished or completed that level of work. And I got a nod that I was correct about that data point. So we're seeing that region stabilize, which means they're on track, right, to get to phase 1 of that reopening. And what are the risks in McKinley and San Juan County? Like we talk about Doña Ana County, what are their risks? Risks are going to be Colorado and Utah, although Utah has had in my opinion, that's a slower kind of reopening and has enhanced their testing. So they're following the kind of protocols that New Mexico has been following, which I think is the right approach, right? Strong testing and tracing, and then making sure that you're doing what you can about treatment. And then Arizona. And so when these states have opening strategies that don't fit with their own modeling or their own data that they were wanting to have in place, right, a decrease or a flattening, it creates issues for New Mexico. And so we just have to really be careful about that. And it's a great place for me to remind New Mexicans, which is hard. We have commuters that come back and forth to work. That's why we ask folks to telecommute. All right, not every employer can do that, and many of these employers are essential workers, so they've been open the whole time. 2, people have family in these other communities, understood. People have their medical care in other states that live along the border. Well, we don't want to interrupt, right, that you have access to a necessary medical appointment. Those are all things that, of course, we understand that New Mexicans have to be engaged in. But if you have lunch in Lubbock, you're creating risk in Clovis. If you're shopping or going to a movie theater in El Paso, you're creating risk in New Mexico. If somebody in New Mexico didn't practice the right social distancing or got exposure, I mean, this is not about personal fault, just it means that the risk is higher and didn't know they were sick or went to work sick and exposed El Paso workers, and then they went back to El Paso. All of this is tied to the fact that, remember early on, everyone would say that, why can't I be in my car? It's when you're in your car, virus travels with you. When you get out, you're exposing it, transferring that virus to someone else or something else. Or you get it that place, put it back in the car, and you take it home with you. And this is why it's so hard to contain a highly contagious disease. So I'm going to go to Dr. Scrace now about the other question.
Yeah, if we could just show that slide once
About
again.
the peaks.
A peak is a peak. And so it's kind of like a mountain. If you look at the blue dotted line, we could say, at least for what we know right now, that highest point in the blue dotted line, which is all of New Mexico, occurred on or around May 1st. Now, if we relax social distancing or if reopening goes too quickly and we see another surge in cases that goes higher than that peak, well, then that would become the new peak. But at least the modeling we do basically says what's going to happen if we keep doing exactly what we're doing. And when we model that, it looks like the number of daily cases gradually decreases. We don't model by city. The question was about Gallup. We don't really model by county either. We model by region, but that orange colored line is the Northwest, San Juan, McKinley, and Cibola counties. And you can see that that, very much like the upper line, is slowly heading down. And if it continues down, then we will be able to say that the peak in the Northwest occurred on or about May 1st. But all you can say about the peak is, based on what we know today and what's happening today, that was the peak. If cases shoot up again, then we'll have a new peak. Thank you.
That's a great place. New Mexicans, we don't want peaks. So stay the course. Stay the course. Thank you, Dr. Grace. Next question, Nora.
Thank you, Governor. Next, I will go to Jens Gould with the Santa Fe New Mexican. Jens, you're unmuted. Go ahead and ask your question.
Hey, that was the peak. Sorry, I was just muted. If I could ask two quick questions. One is just on what you said, Governor, about June 1st reopening restaurants and other businesses. You also mentioned gradual in there, and I wanted to clarify, will the opening on June 1st of those businesses be 100% capacity? Or if not, what kind of limitations might be imposed there? And then secondly, I wanted to follow up on something you said in the budget, since you've been addressing that a lot today. And that is, it was my understanding that the 1.25 million from the federal government under the CARES Act was earmarked for COVID spending only. And so if the gap is something around 2.4 billion, I'm not sure I see where, how that could be filled without cutting areas like education and healthcare, which you said that you hope not to cut. Could you explain how that gap could be filled without cutting those areas in that case? Thank you.
Yes, so you're right. So the CARES Act, there's been a big debate nationally, and governors, including myself, had asked for as much flexibility as possible by the federal government about making sure that, look, our budget is impacted because we've got economic issues that are all tied to COVID-19. Businesses aren't open, patrons aren't able to go, the oil and gas and other copper mining, worldwide issues at the same time there's a pandemic have created incredible budget stresses on the state of New Mexico. But ending fiscal year 20, which is right now in June, we've gotten information from the federal government that all of the personnel in the National Guard and in the Department of Health and the vast majority in the Human Services Department and in Homeland Security, all of the work that they are doing is COVID-19 related, all of it. Protecting their facilities, making sure that they're doing all the work statewide, delivering food, making sure that we had Medicaid expansion, getting money out to hospitals, all of that related, SNAP shifts, all of that is covered in the CARES Act. So where we've had to do much more, right, in that context, that's money that we believe, based on the guidance from the federal government, that we can apply nearly 100% to those departments. And I say nearly because we'll get more clarification from the federal government, and then my job absolutely is to provide that with the highest degree of confidence to our appropriators to make sure that it lines up. So we haven't made these decisions yet, but if all of that can be covered, and I know that we've spent $150 million in that range on COVID-related activities directly. Well, what does that mean? PPE and testing, not unequivocally just those two things, but those are two easy things where it's clear the state had to make expenditures, and if we didn't make those expenditures, we were going to be in real trouble. So the CARES Act reimburses the state for that. In addition, outside of the $1.2 billion in the CARES Act, federal FEMA money is also coming in, and we're going to apply that and see where that can provide the right offsets. So if I don't, with less money coming into the budget, say 600 or 800 million in this current fiscal year, if between the CARES Act, making sure that we're fully reimbursed for expenditures related to direct things in COVID, like PPE-19, and FEMA money, then this puts us in a position to have maybe another $500 or $600 million deficit in this fiscal year, right? We're still crunching those numbers. Well, we have a very healthy reserves, which I'm frankly very proud of making sure, right, that we ask every year for a 25% set aside for reserves. And remember that many of the administration's priorities were in one-time spending, right? So it's not in the recurring budget. So that's also a protective measure that gives us a negotiating opportunity with the legislature, and we should. So unlike other states that just have these holes and no reserves between what we have available in the CARES Act and the way in which our health department, right, is a statewide enterprise to meet our pandemic response, unlike other states where it's county-led, we're in a pretty good position where I don't anticipate that we're going to have to make deep cuts. But we're going to have to slow spending, and we're going to have to be clear about what we think is also coming from the federal government. Because dealing with the current budget problem is not the same as dealing with what's coming. All right, so we know that because the economy is still stagnant, that oil and gas isn't nearly as high, although thank God it's not negative, that without having those revenues coming in July 1 through mid-year of the next regular session, that's when we got to make sure that our plan and our current spending proposal limits and minimizes that $2.4 billion hole. So $1.2 billion available now from the CARES Act, money from reserves, several hundred million, other permanent fund opportunities allow you to get to $2.4 billion as the total whole. And maybe what would be useful is in a transparent administration, and we're still getting all the numbers, that we expect to be able to provide a proposal about what that budget should look like and what changes we can make in spending and what we're going to get reimbursed for in the next week or so. And we will, of course, make that available to the media because we want New Mexicans to know what we're proposing. And then restaurants. So remember in our, thank you, Dr. Scrasa and everyone helping me. Remember for restaurants that we proposed 50% capacity. Now, why are we doing that? Is that just to be slow about opening? No, it's tied to COVID safe practices. And if you're going to keep 6 foot social distancing, that means that you have to have fewer tables in the restaurant. When you're doing fewer tables and keeping that social distancing intact, that translates to about a 50% occupancy. We've been working with the restaurant industry to make sure that the COVID safe practices that we're going to require are also, right, produced and supported by their expertise about what can be done, what they propose. There are many leaders in the industry in the state that have long been working to make sure that their staff are ready and trained, have already been purchasing face coverings and other PPE that would help, right, create real protection for the restaurant workers and for patrons who are coming to restaurants. So that's the criteria that we've set, and that's why, and that's what we put through the Economic Recovery Council, right, which was supported by that Economic Recovery Council, which has members of the restaurant business and industry represented on that Economic Recovery Council, and that's what's in Phase 1B, slated for June 1st, and everything that we see looks really good, and again, we've made adjustments earlier than that, so we'll come to you through one of these briefings and talk about where we are and what we're doing. But that's the plan today. Next question.
Thank you, Governor. Next, we will go to Brandon Evans with KOAT. Brandon, you're unmuted. Go ahead and ask your question.
Good afternoon, everyone. Quick question. Is it easier? I have 3 questions. Is it easier to ask each question individually and get an answer, or would you rather me just do all 3 of them and then answer in your own time?
So do the rapid all 3. Oh.
That's delayed. Sorry,
Oh.
we're here, so.
Oh, okay.
Brandon, if you can do all 3, but keep in mind we have other folks on who also would like to ask questions.
And the governor forgets.
Gotcha. Okay. So the first one is about this upcoming Memorial Day weekend. A lot of people each year go down to Elephant Butte, get out on the lake. What is the state role versus the federal role of opening up Elephant Butte Park so that people could go out there, and where are you guys with that? That's question 1. Question 2 is, when June 1st comes and we do start easing up more restrictions, would people who flew out of state and came back still be required to do the 14-day quarantine? And the third question is, I know you said the vice presidential stuff is political speculation at this time, but are you willing to say one way or the other whether or not, if you were tapped to be the VP on the ticket, would you accept it?
All right, so let's do Memorial Weekend is an incredibly tough challenge. And it is because it is an important celebration, and we should be remembering our families, and it's a productive family time. It also, in terms of doing that with your families, marks sort of the beginning of summer. And you'll see that there's all sorts of national media about beaches and parks around the country, and governors, just like me, are all struggling with what's the right balance here. So as you know, we have opened up several more state parks around the state, and are working to do that, right, safely, in a steady, productive way. Elephant Butte is tough, and the reason Elephant Butte is tough is twofold. One, you identified that there's a federal marina that was never closed. Now, I asked the federal government to close that because it creates both tension and confusion, and not enough people can get on the lake with just a federal marina. So we have a state marina, state park, and we have wrestled with whether we should open, and I made the decision based on what's happening around the state, even though we're meeting our gating criteria as a state. Elephant Butte poses, I believe, based on what we know about the cases and what we know about El Paso and what we know about a great number of individuals who travel from El Paso to go to Elephant Butte. And so even if you did a limited access, 25% say, of the stateside's capacity for boaters, it's 5,000 boats. And that becomes a high risk in this way. Gas, marina, food, picnicking, right, fishing, coming to the beaches, and really keeping that social distancing. And I think that for folks, it's like, that's silly. We'll all be on the lake, and I'm a boater and a water skier. And Elephant Butte is incredible because it's warm. It's a beautiful community and county, TRC, Elephant Butte City, amazing. But there are also 2 high-risk facilities. So nursing home in TRC and a veteran center. And veteran centers around the country have been decimated by COVID-19 because veterans who are living as residents in the assisted living or nursing home part of these facilities that are in fact operated in large part by states are high risk. Those caregivers, those doctors, the pharmacists, the supplies that come in. You're asymptomatic, you pick that up by people traveling to the lake. One case means the likelihood that it spreads and I lose a veteran, you lose a veteran, too high. And we're going to skip this weekend, but we're going to get to getting our boating lakes open. That's this gradual process, and I know that that is very painful for a lot of New Mexicans and certainly for the economic benefit to that community. And I'm dedicated, so we talked about where we want to spend money and being transparent, which is a requirement of this administration and something that is very important to us. We're going to show that we want money to get back out to these communities. Tourism is really tough. That's your point about, are you going to stop people from a 14-day quarantine? We have no plans right now to do that. That's a very high-risk area, but you know that we did provide some additional relief to hotels and condominiums that operate like hotels and vacation rentals, and we recognize that a large number of those folks are going to be from out of state and kind of hoping that they're quarantining in these communities. Many of them fly in directly, aren't using commercial flights. It's a really tough area, and it's an area that the Economic Recovery Council is going to make their next set of recommendations to me about. So right now that's in place, but yes, at some point as we're dealing with tourism differently, another high-risk area, we have to think about how we manage that quarantine requirement or self-isolation requirement for out-of-state travelers. And for everyone, there are exceptions, right, to healthcare workers, folks who have to come in and out for work, like at the labs. So we're clear about that, but we ask them to take extra precautions in terms of testing, making sure people don't come to work sick, and take all the other necessary precautions. And then the third question, Nora. Oh, so I'm going to do whatever I need to be doing as the first Democratic Hispanic governor of the country to support a Biden presidency. Here's the most valuable thing that I offer to the Biden campaign, is talking about values of this campaign, about the incredible work and experience that I have personal knowledge of Vice President Biden, and to make sure that as they figure out their ticket, that I do everything in my power to support that ticket. In the unlikely event that anything else should shift, I've made pretty clear statements that being governor today in New Mexico is the job I want, and it's a job I'm completely dedicated to. So those are speculations that I'm not paying any attention to in that regard. Making sure that the Biden campaign has access to the resources in terms of my political job, which is on my own time, that I can offer. I do want minority voters to know what the benefits of a Biden presidency can be and what those values are: healthcare, education, a strong economy, equality, dealing with productive immigration reform, all of it. And that will be my job during the upcoming primary, and the general election. Next question.
Thank you, Governor. Just a few more questions. We'll go to Algernon Tommaso with the Las Cruces Sun News. Algernon, you're unmuted. Go ahead and ask your question.
Thank you, Governor and secretaries. I actually have a question for Secretary Scrace today. This regards something that you had mentioned in a previous conference about some of the data that you are using in your modeling, and that specifically pertains to travel data. And if I heard this correctly, you mentioned that as far as travel, when a single unit or traveler is traveling more than 50 miles, I think was the number you stated, that is excluded from the data because you don't want to get truck drivers and commercial traffic moving through the state in there as sort of noisy data. However, in southern New Mexico, travel between major cities, say Lordsburg to Deming to Silver City to Las Cruces, is in excess of 50 miles. And so I'm wondering if there's the possibility of some commuter traffic going on that's not being incorporated into the data modeling and how that might affect some of the decisions that are made. Thank you.
Yeah, good question.
Great question. And we have spent a lot of time trying to figure out the best way to interpret the data. We actually looked at different cut points when we picked 80 kilometers, which turns out to be 50 miles. And we looked at 50, 60, 70, 80, 90, 100 miles to see where the best cutoff was. We were using median travel, and that artificially exaggerated the amount of time people were spending at home. And and then also we looked at the map of New Mexico, just the width and height of a county on average. It's not exact, but on average, I think was 48 miles. If you divide up our square miles into 48, you get something similar. So you're absolutely right. There will be New Mexican commuters who will be excluded from the data. Additionally, there will be supply chain folks who, let's just say, drive in one of the western portals of New Mexico, go to Gallup and go back out, will be included because it's less than 50 miles. But as we looked at the various cut points, and the other thing we did is we looked at major freeways, I-25 and I-40, and it seemed like the the cut point of 50 miles or 80 kilometers filtered out a lot of what looked like more traffic through those major highway counties. So there's no right answer to that one. Every cut point has advantages and disadvantages, and when we looked at the choices we had, that seemed to get us the closest. But you're right, lots of us. I drove from my home in Placitas here. I'll go back. That will be more than 50 miles today. Not sure whether my cell phone will be in there or not now that I think about it, but across the county line as well. So there's no perfect answer, but it was the best approximation. And the folks from the national lab have actually rejected the standard way that data is presented and adopted ours because that level of travel does correlate the best with new cases. So we feel good about it, but you're right in pointing out some of the shortcomings. Thank you.
Next, we'll go to Julia Goldberg with the Santa Fe Reporter. Julia, you're unmuted. Go ahead.
Thank you very much. Two quick questions. The first relates to Dr. Scrace, I believe, said earlier in the conference that New Mexico had not had any deaths under the age of 30, but I believe on May 14th, the health department reported the death of a woman in her 20s in McKinley County. So I wanted to check on that discrepancy, but my larger question was, on Friday, the Colorado governor reported that the state there was going to report to the public its deaths from COVID-19 differently and distinguish between people dying with COVID-19 versus of COVID-19, and he attributed that discrepancy to federal reporting guidelines. I was curious if that had any relevance or bearing in New Mexico. Thank you so much.
So I am going to defer because Dr. Scrace can look it up. I don't have my computer right in front of me. And I have to say that I do remember that we had someone under 30, and I don't want to be biased by your question, but we're going to look that up right now. And we want to make sure that we're being accurate, and we appreciate someone making sure. You might have had one. By and large, right, it's been older individuals. Again, it's all tragic. But we've seen maybe some of the data points, particularly for me as I'm looking at who's impacted and who's at risk. We've got incredible numbers of individuals in our COVID-19 positives, in that 35 to 60 range, showing that younger individuals certainly aren't immune from A, contracting the virus, B, of course, spreading the virus, and C, having serious health consequences as a result. So I want to make sure about that. And Doctor, did you find that? Okay, so I'm going to go to you and then we'll come back.
There was a death of a woman in her 20s on the 15th. My best guess is that we compile that mortality data on a weekly basis, and so that graph did not include it. So I apologize for that because I said there were no deaths under 30, and that is correct. And then the second question was
about how Colorado changed
their COVID-19 mortality.
There's a question about whether, and I've got a lot of emails about this, a question about, well, how many people would have died anyway during this time, and how many of these are COVID deaths and how many are not. And, often we know at the time a patient passes away that it was COVID. We have a culture result or something else. Sometimes we find out much later, and if you're following the news or the medical literature, they're going back actually to people who passed from pneumonia in January and December and identifying retrospectively that those folks had died of COVID. I think the best study on this with the largest numbers is New York City, where they looked at the total number of deaths, which was about 25,000 during a defined time period, and then the number of deaths that were COVID related, and then the number of deaths that normally happen during that time in prior years without a pandemic. And it looked like in that large data set of 25,000 people, exactly 3/4 of the deaths were COVID and 1/4 were other causes. And the other causes were about equal to what they'd seen in previous years. So we're still reporting the folks who pass away from COVID as deaths. As we get additional guidance, we can update that, but we haven't revised our accounting for that or our methodology for declaring that. But I think it's likely that over time, if people have Office of Medical Investigator evaluations or post-mortem cultures, sometimes people die in their home of what is presumed to be other causes. It may be possible that we'll see retrospective identification of folks who died of COVID as well.
Right. And I just want to point out that as we get that both national and state guidance from the medical assistance team, we want to make sure that we do report accurately, right? The number of lives lost related to this virus. That the more we know about that, then the more we can educate folks about the risks and look at ways to mitigate mortality rates. It's incredibly important information to provide to minority communities, individuals who have chronic care conditions. And you might recall that we've talked about data that we know for H1N1, a flu that could have dire consequences for certain individuals and lead to death at a much higher rate than influenza A or B. That we learned that Native Americans had a mortality rate 4 times higher, right, than any other groups. And as we look at this, it's going to be very important information to really look at what those now mortality rates look like for a variety of high-risk groups so that we can do the best job providing medical data and evidence to look at better strategies to one, prevent, to be really clear about what we can do to treat those chronic conditions and get more health care out there, and 3, to make sure that we start working on treatment protocols. And no one's asked me about Remdesivir, and we've gotten 2 shipments and expect another one that's about 20 cases. Well, actually, I think it's a little more. I think we're going to get 28 more cases is on its way. 20 cases is on its way. We've received 28 cases. Each case serves about 100 patients. And so, or each 20, I think, serves 100 patients. And why is this complicated? Because that treatment protocol can only go to a healthcare institution that's qualified to accept this medication. It can only be delivered intravenously. And as we get it out to other hospitals to do that, we're going to learn data about the effectiveness of this treatment and on which populations. All of that ties to knowing as much as you can about what's happening to individuals who are infected with COVID-19. But at this point, we're going to stay the course. And maybe just one more reminder. There are challenges to some states, and we'll see whether those bear out to be real challenges or not, about whether or not they're being forthcoming about the number of individuals who are positive and the number of individuals that they lose in this battle against COVID-19. We need inspector generals, and we need accountability and oversight. And having the media have access to all of our data points and question us is very valuable in making sure that New Mexicans have a great deal of confidence in what we report, how we report it, and why we report it. Because the knowledge about this particular virus and any other infectious disease helps us protect New Mexicans, and that's exactly why we gather it and exactly why we report it. So I really appreciate this question. It's a very valuable one.
Thank you, Governor. Next, I'm going to go to Matt Grubbs with New Mexico PBS. Matt, you're unmuted. Go ahead.
Thanks again. I appreciate you doing this and applaud you for doing it without an intermission. I know it gets long. couple of quick ones. One is how and how often are you going to be communicating with the restaurant folks over the next 10 or 11 days? And the second one is, have you backed off your 7,500 goal for testing capacity? And if so, what's behind that? Thanks.
I'm happy to communicate with any stakeholder as often as I humanly can, right? I mean, I work for everyone in the state, and I want to be clear, not every business group agrees with the recommendations from the Economic Recovery Council or the strategy, but by and large, the overwhelming majority of New Mexico businesses have worked really hard, not only to comply with our orders, but to think about ways where they can create COVID-safe practices. The leadership in the restaurant industry in particular has really, in my opinion, bent over backwards to really identify two things. How can we help you feed people in New Mexico? So a shout out right now to WEX, who is both looking at ways to feed hungry New Mexicans and to have first responders make sure that they're getting access to quality meals when they're on the go and at work, and to make that safe and productive, and senior citizens and healthcare workers. And you know, it takes incredible leadership for a business who can't operate in the way that they are accustomed to lean in and provide at their own expense, right, these services and benefits to New Mexicans. In addition, actually, and WEX is not the only restaurant, many restaurants statewide have worked on retraining their personnel, getting ready for COVID-safe practices. That means, right, that we have disposable menus or chalkboards that stay up, that people don't touch, that we're very clear about minimizing the amount of touching and social distancing. Some might put up plexiglass barriers, but some might just change the way in which their tables are situated. The basic COVID safe practices suggest today that there would be only disposable tableware, but there are some other strategies in the mix. I mean, they've really done an excellent job, right? Contactless payment, reservations in advance, metering outside, any number of things to really reduce wiping down tables and the restaurants on the floors after every single dining experience. I mean, it's an incredible heavy lift by the restaurant industry, and they're doing it, not just here, but around the country. So we're going to keep talking all of the time. And I talked to many yesterday, and we'll keep having those conversations, because that means that I learn what opportunities we have to do things differently and maybe even sooner, and that they also know that they can plan and have predictability in their operations and opening up. So I'm happy to do that, and I'm really grateful to them. I wanted to make sure that that was clear. I'm really grateful to all industries. This has been a tough time, particularly for our family-owned small businesses, right, that have had decades of experience and relationships with their managers and wait staff, and this has been really tough on those restaurant owners and communities, and I appreciate the opportunity to make sure that they know that I understand, and that we're all looking forward to, you know, keeping our curve flat, bent, and showing that we can safely reopen. And because I'm terrible, I already forgot the second question. It was the second question, wasn't there? Matt?
7,500 tests.
No, we're not backing off of that. So, and I'll make sure that the secretary, who did adequately remember the second question, so thank you. So New Mexico has, and I've talked about this before, several laboratory facilities, laboratory experts, and instruments, right? So including Sandia National Labs have laboratory instruments, and they can and are running COVID tests. And that's valuable to us because we count it towards, you know, making sure that we are testing 7,500 people, that we want to get there every day. The gating criteria says we have to do 5,000 as a rolling average, and we're meeting that. The gating criteria is what we use to decide that, you know, it's safe to reopen because we know who's positive, we're doing enough surveillance work, we have a sense about rates of transmission. All of that gets included in the gating criteria as a whole to make those decisions. So why then increase capacity? A, because we can. Frankly, if we didn't have any supply chain issues and any personnel issues, New Mexico is a state that could exceed 7,500 tests readily. We have enough instrumentation and partners to get well over 10,000 a day. But let's talk about why we don't have that in our proposal for our testing and tracing plan once we were identified as one of the CDC pilot states. Because I have to rely on a supply chain that the federal government keeps interrupting, including now swabs, that each instrument requires certain personnel, calibration of those instruments to run the test, and depending upon which laboratory instrument it is, whatever the reagents are, right? So that's what you have to add in order to know whether or not you can pull the virus in that particular lab sample. And so that is one of my extra full-time jobs, is to work on keeping that supply chain working. So I just want to make sure that I highlighted it has become incredibly complicated, and this is why there's such great disappointment by governors, bipartisan at the federal government. If you're going to interfere with the supply chain, make it fair, available, and readily, accessible by every governor in the country. Do not take credit for the orders that I or the secretary have accomplished and we're moving here and send them someplace else. And two, you should have used the Federal Defense Act to make sure that you had enough supplies being manufactured in this country all of the time. So the only reason we're not at 10,000 or beyond is because that's a supply chain I don't have enough confidence in getting, nor do we have enough personnel to collect the samples every day and to run them in any number of these laboratories. We can get to 7,500 and are well on our way. Gating criteria, which means it's safe to open, because I know, I'm looking at, I'm doing the right kind of surveillance statewide, is a rolling average of 5,000. Secretary, did I miss anything about that? Which is why she gave you some other partners. I force everyone in the state, know where your assets are, always develop private sector partners, figure out ways to keep expanding. But that's why those numbers didn't seem like they matched up. Secretary.
Thank you. I'm confident that the state can do 7,500 now, given an adequate supply chain and given all the other factors. We have the capacity, and we generally have the manpower. And that's a shout out to the Public Health Department, who are largely doing thousands of tests a day. I also thank Presbyterian Lovelace and our other private partners. But we can do it. But we dispense the swabs, as the governor was saying, and then we have to be careful with how we are collecting specimens from that point on until we are restocked. So it is largely a supply chain problem, and on any given day, which labs can accept the number of specimens that we are collecting. So it's a complicated process, and it's difficult to manage, but I am confident we can do it.
And I'm going to do one more thing that I failed to do last week, and it's both kind of an area of criticism and also a shout out. We have incredible partners in the state, and we have equipment, these instruments that run any number of laboratory tests. You get a blood test, it goes to a lab, they run it. You get a viral swab, you're looking for a virus. You do a saliva test for any number of things. They go to laboratories and laboratory techs who run the tests and let you know what the results are. We have a lot of that asset in this state. Which speaks volumes about not just preparedness, but the kind of expertise we have, including at the national labs. The national labs combined can run just about 500 tests a day. So they have personnel who can take the samples, then they have the equipment and the equipment techs who can run them in a 24-hour cycle. Until very recently, both Los Alamos and Sandia do maybe collectively 35 tests a day. That's a criticism. They have for weeks had capacity to do much better than that, and frankly have failed, I think, to meet that in terms of our efforts to identify what effective surveillance is, particularly in essential high-risk workplaces. So what's the shout out then? Well, the shout out is they didn't back away. You know, the national labs don't have to participate in our public health testing. They use those instruments for any number of things. Frankly, the Secretary of Energy, Secretary Brulette at the federal level, has been very engaged and very helpful. The New Mexico federal delegation has been very engaged and helpful. And what hasn't been helpful is both laboratories have been following very narrow CDC guidelines for only testing symptomatic individuals. And it's just been the last day or so where that clarification has been absolutely made yet again to both labs. And we are looking forward not to be critical of their efforts, but to highlight that they are full-on partners to get us to as many tests as possible every day in the state of New Mexico, because that's how we stay open, because we know about the virus, we isolate the virus, we isolate the risk of transmission, and we keep people as safe as possible. That's the goal here. I just wanted to make sure that I did that. Nora, next question.
Thank you, Governor. This will be our last question, going to Jeffrey Plant with the Silver City Daily Press. Sorry about that. Jeffrey, you're unmuted. Go ahead and ask your question.
Thank you. Governor and Secretaries, how are state and local authorities instructed to deal with business owners and their customers who defy the revised public health order? For example, by offering table service in restaurants or treating the face covering requirement as optional for customers. What are the consequences of violating the public health order? And quickly, just a second question regarding the budget. Considering the revenue and employment implications, would you like to see the legislature pass a recreational cannabis bill during the special session? And if not in June, how much of a priority should recreational cannabis be during the 60-day session? Thank you.
I appreciate your questions. All right. We do expect local elected leaders to participate in making sure that their constituents and their businesses follow the public health orders, and there are consequences. And I don't think most New Mexicans are aware that we are now in court with the mayor of Grants for not only violating the public health order with City of Grants operated activities like a golf course, but instructing private businesses to ignore our public health orders. And we have a system of compliance that is a partnership between, the Department of Health, who has enforcement powers for public health orders, the state police, who are full-on partners, who provide the cease and desist notices. We try to do warnings on the front end, We're not trying to play a gotcha game here with businesses. We're trying to protect New Mexicans and then make sure that we don't have to go backwards. And for local elected leaders who do one of two things: purposely engage in asking local businesses to stay open or to defy our orders, and we've had some sheriffs do that, and other elected leaders or personnel hired by local government. There are consequences, and the Attorney General will make sure that folks are held accountable. So you can't be potentially covered by any number of local government protections like the Tort Claims Act and related issues. And so you can't just be an agent of a local government and defy the law. You cannot. And we're going to keep making sure folks are accountable. But I want to highlight some incredible leadership, and it's not the end of leadership, There's a lot of it. And we've seen it here in Santa Fe, we've seen it in Albuquerque, and I've given shout outs to Mayor Keller and certainly to the mayor here, but I want to give out three particular shout outs: Mayor Crawford, Mayor Morris, and Mayor Sam Cobb. Each one of them is helping us promote wearing of face masks and making sure that their community knows that they stand behind whatever public health orders we put in place. They're clear that the state has not just a responsibility but the power to do that, and that what we should be doing to get people to comply is modeling good behavior. That's the best thing we can do. And that's incredible leadership, and by and large, The mayors around the state are showing incredible leadership. Mayor Weber, early on here in Santa Fe, counseled any number of significant events tied to Santa Fe's economic well-being because he knew that they couldn't meet the public safety and public health requirements. Bipartisan, mayors, county commissioners, and county managers, by and large, have been really helpful. We have had some instances where that's not occurring, and we're trying to resolve that by making sure that folks know where we have to enforce, we will, because that's not fair to everybody else who's following the rules. But by and large, we're trying to practice positive role modeling to make sure that people stay the course. But there are consequences. And the last question, no, I already forgot it. You forgot it too. Oh, thank you. Let's end on a high note. Okay, no, people are tired. Look, I said on the day that oil and gas was significantly dropping, frankly, during the legislative session and then certainly right after, that the vetoes and changes I made in capital projects in particular likely would not have occurred before we were clear we were in a pandemic if we had passed recreational cannabis. So the projections are nearly $100 million of recurring revenue into the budget. And if we want economic support and economic relief, then we have to use every economic idea. And I want to point out also that the vast majority of New Mexicans favor recreational cannabis. And we have an opportunity. This special session is really going to be focused on dealing with the budget gap, all right? End of year, and making sure that we erode entirely or mitigate to the highest degree possible where we're headed for FY21. But I think that all of our policymakers need to think clearly, and they should expect me to be supporting in the next general election, that we have to pass recreational cannabis in the state. We need to diversify our economy. We need to increase opportunity for recurring revenue. And we have to rebuild an economy that has suffered dramatically during this public health crisis. So I really appreciate that question, and that should not be the only economic recovery tool or investment in our toolbox moving forward. I want to thank every New Mexican who tuned in, who keeps tuning in. I want to thank every New Mexican who is practicing COVID-safe practices and supporting their families. And I want to end with reminding folks that social isolation has an impact. There are risks associated with that as well. Please reach out to any of those behavioral health supports that we've identified. They are meaningful and helpful and reliable. And we want to make sure that we're safe in every context and supported in every context to the highest degree possible. Thank you again for doing what you're doing. Thank you for tuning in. Have a safe and pleasant evening, and I'm looking forward to coming right back at you after Memorial Weekend.